Yeah, Carl. Oops.
Hello, hello. I'm on my phone today, so let's see. Oh, we have a doctor. Oh, wonderful.
Dr. Ketki, Madam.
Hello.
Number 9.
We are just waiting till everybody is in is correct room. It will take some minutes, I think.
Can you please make me?
Great that we are all here
course.
again after, I think, 2 weeks.
Yes.
Yes. And I'm so happy.
Good to
that,
see everybody.
Yeah, I almost can see everybody, not everybody, but most of you I can see. I think we are almost completed. I try to change this. Yeah, that looks good. 2, 4, 5, 6, 8, 10 people. Great. Wonderful. Yeah, I'm so lucky that I have the chance that Dr. Hemang is next to me and I have the opportunity to host him again a weekend. We did it 2 years ago, 3 times a year, and I got used to it to have him here. Yeah, I think 5 long years.
Rajashree, Madam.
Yeah, but on the other hand, the web consultations also have been really a good opportunity to reach people all over the world, because otherwise we wouldn't have got in contact with people in Budapest, in New Zealand, in Australia, and wherever, Peru, because now they got this opportunity, and that's really, really perfect. But the best way is to have him right next to us, because so it's easier to really to learn and to notice how he gets in contact with the clients, like all of you just mentioned before. It's really, yeah, I learn most of it in these times when I'm really close to him and watching how he is acting.
Right.
Do you get to feel the pulse when he feels the pulse for someone? Do you get to do it as well?
Just a second. So you mentioned if I also check the pulse after Dr. Hemang does it. I really tried it once or twice in 2 different sessions, but for me it's really difficult, because when I'm in the session, I'm translating. I'm trying to translate really in a good way. I try to be in contact with the client, and at the same time, to feel the pulse, I need to settle down. I need to clear up my mind. And this is too much. I can do one thing or the other thing. I'm not a professional to do both on at the same time. I really tried it, but
maybe
I hurried up. I thought I have just a second to feel, and I try to match. It's too much in my brain.
Put in them waiting room and come back.
And so
it'll happen soon enough.
Yeah, it's a good. At first, it feels like a good opportunity, but on the other hand, it's not working. It's not matching, because I need really time. I do it on the other way when I get somebody, a friend who's visiting me. I said, come on, give me your hand. Give me 5 minutes. Let me check just. And I try to calm down and to clear my mind. That works.
So now
but
it
just
should work.
On the way and somewhere in between and just a second, and with my mind and my emotions somewhere else, for me, it's not working. It seems to be the best way, because I know what he's feeling, because he's writing down, we are talking about it. I also feel the pulse, and I can just compare am I right or not? But it's not as easy as it looks like.
In theory, it works, but in practice, it's just not right. Yeah.
No, it's just you're catching up a little bit, but not the whole picture.
Ketki madam is there. Dr. Ketki.
Good. Yes, yeah,
Yeah,
she is.
Ketki madam. Hello. Ketki
Yes,
madam.
hemang. Yes, yes,
Yes, can you please start sharing the stories? I'm just
yes,
coming.
yes.
Yeah.
Yeah.
I'm joining back just in a couple of minutes. Okay.
Yes,
Just I'm
yes,
in
that's
the
fine.
main
No,
room,
no problem.
sorting
Yes,
out
yes.
the things. Okay.
Okay, okay, okay.
Good. I cut it off. No problem. And then I checked everyone else's room. Everyone is recording. There's only 2 people needed some help, and I just helped them out. So as soon as you're done here, you can go back into your own.
I can very much relate to what he's saying, Ilka. I mean, for me, it was the first experience ever. I've never been to pulse reading, even just for myself. So this was, you know, the first time. And yes, it can be very difficult if you have to write, like all I was doing was listening while I was writing my notes. So if you have to listen, write, and translate, that could be very challenging. But I think as Anya and I shared some of the similar takeaways from our experience. You know, there was, for example, just going back to the communication, there was a patient that came there with his son. And from just the communication itself, we could hear that he is so blocked. He doesn't see any possibility anymore, you know. So I've been telling him, doesn't do this, he doesn't do that, he's not like this, is, you know. And Dr. Hemang was just listening to everything. And at the end, Dr. Hemang said, okay, thank you very much, but I want to communicate directly with the child. That was such an incredible experience for me, because the father was saying he is not even open. He's not interested in speaking with his parents anymore, but he doesn't study. He only plays video games and all that. And but when Dr. Hemang said, let me just speak with him, for the first time, the boy opened up and start talking about what he wants in life, what he wants to become. Like the father said, he's not even interested in becoming anything or anybody. So, you know, there was just so much learning in there by just listening and observing and watch Dr. Hemang. Sorry, Dr. Hemang, I'm just sharing about the father and son situation. How you help the boy to really open up and start talking about what he wants, what he enjoys best, what he might even want to be one day, you know, stuff that he's never shared with his parents. So exactly. I think that was so yeah, very interesting to see that by communication alone, there is already healing in it before you even get to, you know, to diagnose the patient. So for me, literally every minute, and I had an opportunity to be in a couple of sessions with different people. Every minute was a minute of learning and revelation, and see what's possible and what could be done and what is available, only if we are observant enough, only if we give the other person an opportunity to feel comfortable and start opening up. So yeah, that was I was very sad last night when you had to go, Dr. Emma, because it was like, I want to come back tomorrow, you know, for more. I even said, well, you know, you should have told me I would be driving you to Hamburg right now. You know, it was just an incredible experience.
Thank you, Sissy. And yeah, I'm happy to see that you have great observation power, strength, that the message word and which we wanted to give you all, that is you got perfectly. So it's not only learning the pulse, but more than that, it's the words, communication. And in future, we will learn and we will talk more about the which words to use, which words to avoid using. See, it is nothing from me. All what I have learned from the Dr. Naram, Dr. Smita, and all, this is what we apply in the practice. And it works well. The most important is people are coming with the sufferings, pain. Pain doesn't mean only joints pain. Maybe it's an emotional pain, maybe it's a skin trouble, also maybe it's a child wish, maybe something. We want to give them first hope that there is a possibility. That comes through the word, that comes through the support, and that not just saying that yes, there is a possibility, but to create and to show them that in the reality, in the actual way, how is it, how can we help you, how we will be able to help you, what we will do together so you get the result, you reduce your sufferings. That is what our always the expectation, target, and goal. We have Dr. Ketki madam today. She is second senior most doctor in our group, in our Ayush Shakti, like a team. And she has a lot experience. She is with Ayush Shakti for more than 32 years, 35 years. She will talk about like a one or two case study, what and how she helped miraculously to the some people. Yes, Ketki madam.
Yes, hello everyone. So I had a wonderful case of a young girl. She was suffering with rheumatoid arthritis. And when she came to me, she was just 18 years old. And she didn't have this hereditary. That was also a surprise for us. So when she came to me with her sister-in-law, then first though she used to cry a lot because she was suffering a lot, lots of pain was there, lots of stiffness. She was not able to walk also at that time, and lots of suffering was there. So when she came to me, she lost all the hopes. I told her, don't worry at all. In Ayurveda, we have very good treatment which will really help you. Well, then again she cried because she's so young and she doesn't understand what is going on with her. So at that time I checked her the pulse, and in that lots of arm was there, vata was there. She was very lean and thin, and not able to walk also. And lots of pain is there in some joints, lots of stiffness, lots of swelling was there, fatigue was there, and her bowel movement also was not clear. So first I told her, ki you have to keep some patience and we will start the treatment. So I started with the Panchakarma treatment and some herbs for her. So in that, first I started with Potli shake and Siddha massage, which works wonderfully in rheumatoid arthritis because it helps a lot to reduce stiffness, swelling, and pain from the body. And I put her only on mung and vegetable diet. No type of roti, no jawar, no wheat, no gluten, nothing, no milk, no dairy, no bakery, nothing. Only mung and vegetable and khichdi, nothing else. First, she was not ready to do all this because she was very young. But then after 2-3 days, when she felt better with the treatment, then she started following diet. She came to me in 2012. At that time, her RA test was showing 122.4 reading. She took treatment 6 years, because we know rheumatoid arthritis, it is an autoimmune disease. So it's difficult to cure. But then she also had lots of patients. Her mother explained her, because she was very young and she used to follow everything properly, whatever I told her. And we did Panchkarma not only once, we did it 2-3 times in these 6 years, And in 2018, when she did the test, it was only below the 10. It was 9.5 reading was there, and there was no pain, there was no stiffness. She was able to walk. After 2-3 years, Acha, I gave her medicine. In that, I gave mainly in our Ayush Shakti herbs, whatever we are giving for Vata problem. That is Mahavat Nashak, Pain Mukti, MJ, Shandikal, Surudai, Uriton, and Romanil, and Ojas definitely, because it is an autoimmune disease. After 2-3 years, she was completely fine. Then after 3 years, again she came to me. At that time, she was diagnosed with autoimmune thyroid level. Her value is very not so high. So again, we did Panchkarma. She was married also, and doctors told her not to conceive at all, because she was suffering with this type of autoimmune disease, rheumatoid arthritis, and then thyroid. So again, we started with the thyroid treatment. At that time, she had little pain in joints, but not so much. Uh, and I started with again Pain Mukti, Shandikal, Uriton, Suruday, and Chandraprabha, because she was not ready to take any allopathic medicine for thyroid, because she got tremendous result in rheumatoid arthritis. So she had completely faith in our Ayush Shakti, and she started again with the Panchakarma. And after that, after 2-3 years, she was married also. And again, she came to me, doctors are saying that I can't conceive. So I told her, no, definitely you can try. I gave her some herbs. She tried and she conceived also. And now she had 2 years baby boy. And she's completely all right, 100% all right with all the systems, all the symptoms. She don't have any type of pain, no stiffness, no thyroid, no rheumatoid arthritis, nothing. She is not taking any medicines. Sometimes she had any acidity problem or joint pain. Now, before she used to stay in Mumbai, but now she is in Pune. So today only she came to me with some other problem, because any problem, now she is consulting me only by phone, or whenever she is coming to Mumbai, she is coming here in Ayush Shakti and taking the medicines. So that is a very good result in my patient, which I shared with you. If you have any queries regarding this, definitely you can ask me.
It is very important to produce the result and to give the result. Make person to continue taking the treatment. Treatment doesn't mean only taking tablets, but to make sure that the person following the diet, home remedies, marma, everything. And it is many times we have observed that it's a big challenge to keep have the person continue all the time for a long time, just continue. It's big challenge. It happens only when we have a strong, a convincing power on the patient, and that convincing happens through the faith, trust. When person feel that yes, this doctor and that this practitioner will help me, and they see that kind of the feeling they experience, then only it happens. So it's how to make it happen, how to do that, what to do special, what kind of the techniques to apply, so person can have the real a faith in us. We will talk in some other session. Today we have the another senior most doctor of Ayush Shakti, who has great opportunities he had a great opportunity to work with Dr. Naram closely for many years. And it's says of one of the doctor to whom Dr. Naram was always trusting for anything, for any special case, he was always referring to send this patient to Dr. Mehta, to Dr. Rajashree Mehta. She is great, more than 35 or 37 years, she is with Ayush Shafi and helping us so many clients, requesting her to share a story. Some of the case client, some case study. Please, madam. Madam, you are mute. Maybe you are mute.
Yeah.
Yes.
Yes.
Please.
Hello. Good
Yes.
evening.
Yes,
Yeah.
ma'am. Good evening.
Yeah. Today I want to share one patient about depression, very deep depression. And she was very, very, very intelligent. And I have seen whoever very intelligent and when they are becoming failure in their ambitions, they got this very deep depression in their life. So one day the parents, they came with the one girl. She was about 2021. She was studying science and they came and they were crying. Okay, my daughter, she's going for the exam since 2 years, and after one or two papers, then she started that I don't want to give the exams. And she was coming back. She was not ready to give the exams. Always she was on the first rank. Always she was staying on the first rank. And when this starts to come on the second rank, and she becomes depressed. Okay, why it's happening? I want on the first. And that was the main reason. Then I started to work on her. At that time, we had given some medicines to her. And I prescribed the medicine like Amrutras, Suraday, Jivan Rakshak, Sumedha, Bliss, Mind Power. And with that, I started with the Shirodhara treatments. She was not ready to go for the Panchkarma. I had given only the Shirodhara, and Shirodhara, it has worked like anything on her. And I had given the about 10 to 15 session of Shirodhara. She was coming every day, and every day there was some little change. And one day she came with the so big smile. Sagupta, the name meaning is the smile and love. And I said, Sagupta, now we have proved your name. Okay, you are a Sagupta with the big smile. And then she becomes so happy. And she said, Madam, now I'm ready to give the exams. And she has completed her exams. She become first in her study. And then she got married. The parents, they said that don't tell anybody her name. But now she become mother. She's a children's mother of 2 children. And she's so happy. Even parents, they are remembering me. And they are sending some patients to me. You go to Dr. Mehta. Thank you.
Nice. Great.
Can I share one more patient?
Yes, madam, please.
Yeah. Without doing any Panchkarma, we were treating in the beginning the young generation. And then there was this patient like a PCOD patient, and she was just 19. The parents, they were very worried about her problems. She was not getting the periods. The periods whenever she was getting the menstruation, it was after 3-4 months, 5 months, and they were giving the medicines, allopathic medicines. And I told them, then stop any allopathic medicine. It's a hormone. Hormone always make your ovaries very lazy because you are giving the food to the ovaries. Like how we are giving the food in our home. If somebody is there and we are giving the food, then they will not agree to work. In the same way, we are just feeding the ovaries by hormone. And then first of all, I stopped the hormone tablets and I said that You have to wait. You have to see. Then when it's her menstruation is starting, I had given the medicine in double, triple dose. Sati, Sri Sanjeevani, Kumarika, Chandra Prabha. This all the medicine and even Granthir also. Keton was there. And previously she was getting the menstruation with the hormone medicine. And after some time, naturally she got the menstruation after 5 to 6 months. Then I said them, this is 5 to 6 months means a period was there, and then now it will be little reduced. Instead of 5 to 6 months, it will come in 3 or 4 months. And it happened. They become so happy. Yes, it's working. Then you have to tell your daughter to go for some exercise and that all. She has to walk at least 1 hour a day. She has to follow a strict diet. We stopped her some carbohydrates, sugar, milk, heavy milk products. Because generally nowadays what happens that in India I have seen, I am not aware about the outside country, but in India, when the any children, and especially in girls, it's happening. See, they are coming in the 10th standard, 11th standard, 12th standard. It's a board exams. They have to work hard. They have to study hard. Then they are sitting on the one place. They are studying, just sitting, studying, eating. And in this way, they are becoming so obese and there is no any physical exercise. But I told her, you have to do this work. And then I explain about the housework also. Okay, just you help your mother and do some work, and then she will be also very happy, and your body will be more flexible. And she started to do that. And then after 3 months period, it started to come after 2 months, then 1.5 months. In this way, the time period has reduced, and gradually that PCOD problem has just disappear, and she become the mother after got married, and she has also the 2 children. She is staying in Pune, and whenever the parents and relatives where they are coming, and I'm asking what she is doing, she is remembering you. So
Great, great. This is a great story example, and the idea about like in many times the reason behind the actual thing is a different. It's not only to fix what we see. Like here, just by fixing hormones, maybe we don't get the result. But working on the other level, beyond the picture, beyond the scene, we need to look at. And in the other case, like a depression, that is a big challenge to convince the depression patient, depression client to start the treatment. It's also a technique. Good. Sissy, you were asking something. Want to?
I'm sorry, I just have a question. It's a case of she's 21 years old, she's Vata, very fragile. You know, the wind just needs to blow and then she will have cold. That's how fragile she is. And she is taking birth control pills, not because she wants to, but because she feels she has to in order to get some relief. She gets excruciating pain during her cycle. And I'm trying to find a Ayushakti solution. I don't even know if it's possible to get her off the birth control pill completely, but at least to supplement that what she's taking, not to rely on it, and also for it to, how can I say, sort of control her cycle, which is apparently why she's taking it right now. She has to be on it so that her cycle could be controlled for some reason. For someone like that, she's had COVID twice, and she's studying. That's my daughter. She's studying. She's in London. I don't know. What would you suggest?
Sissy, can I know that what's her age?
Pardon?
What is her age?
She's 21.
21. Okay, in this case, you can start to give some Prasnadi, Chandraprabha, and Gas Mukti tablet. And before getting the period, if the period is on date, then just 3-4 days before, she has to start with the Virechan tablet, at least 1 or 2. And this is going to help like anything. And then pain will be really controlled and she will feel much better.
Thank you. Thank you.
If
Good.
there is a need, then I will post you. I will WhatsApp in the 9th group that what the medicines you have to prescribe. Yeah.
Yes, that will be good, madam.
Yeah.
Perfect. So many times this our name of the medication is not so easy to understand and remember.
Yeah.
So
Just
perfect.
to make
Good.
sure that I've
Maybe
got the
you can also suggest like a complete protocol of the treatment, including like a home remedy and diet to focus more on.
that I will do.
Yeah, please. Thank you. Yes, Anya.
I just want to ask the patient with depression. You mentioned you gave him herbs and then a massage or another treatment. I didn't
It was
get it.
Shirodhara.
Ah, Shirodhara is
Kirangus.
the herb. Mhm.
Yeah.
Okay, thank you.
Kirangus. Good. Yes. So here we have heard from our senior most doctors. Yes, of course, they have so many thousands, millions stories. But we want to tell you different things. That we have a doctor who has joined Ayush Shakti just few months before. And they learned from this madam, Dr. Rajesh madam, Dr. Ketki madam, other mentors. And now, in the couple of months only, they also produced such a great result, which otherwise was not possible according to the normal school medicine. And I would like to, we can hear it from Dr. Komal in her words, because she has treated that small boy. Please, Dr. Komal.
Yes, thank you, sir. Am I audible?
Yes, perfect.
Yeah. So, namaskar, everyone. First of all, I will seek the blessings of Lord Dhanvantari, the great masters like Baba Ramdas ji, Pankaj sir, and my guru, Sadguru Vena Bharti Maharaj. And after taking their blessings, I would like to share whatever I have done. So, when I saw this patient, he was 21 years old patient. So there were two patients, 14 years, one boy was 14 years and the other female, she was of 21 years. So I will share the case of the boy first, what sir was saying. So when the boy, he was 14 years, he came to Ayush Shakti clinic along with his father. And his father was very concerned because the child was suffering from severe chest pain. And the pain was, he was suffering, a very severe pain was there since 2 months. And since 2 years he was suffering, but the pain had become very acute since 2 months. And they had taken treatment, everywhere, but the pain was not going. And then they had come, so they wanted to take treatment from Ayurveda. And then when they came, they first told me that we are here after consulting many doctors, and then we have come to you. So we want Ayurvedic treatment. So is this, can you cure this? So I said, first I will examine and then I'll see what we can do. So when I examined and I listened to his name was Samal. So when I listened to Samal, and I understood that his pain, whatever chest pain and everything in the year 14 years of age, and he had brought all the reports also. So there was nothing major, not anything related to heart disease or something. So first I ruled out that. And then the chest pain, whatever I examined, and from the pulse diagnosis, so I made a diagnosis that it was related to rasa dushti. So we have learned in the session about rasa dhatu. So when rasa dhatu it becomes vitiated, then it may lead to conditions like chest pain. So that I made a diagnosis, and of course I consulted my seniors also, and then we along with my seniors, after consulting with them, I planned treatment, which was I gave him Diviro. So Diviro is a wonderful medicine. I gave him Diviro in the dose of 2 tablets, uh, 2 tablets 2 times, and along with that I gave Divya Shwas again 2 tablets 2 times after food, and with that Ojas. So Ojas tablet was also given, and I called him after 7 days. Generally we give 15 days medicine, but with this patient, because he was having chest pain, so I told his father to bring him after 7 days. And then in the 7 days I was also searching what else we can do. And yes, I also treatment, whenever we treat a patient, it is also about 3 things, which is the food, the lifestyle, and the medicine. So it is never only the medicines. So this was the medicine part. Then regarding the food part, I told him that skip all the wheat products and skip all the milk and milk products. So this boy was actually, the credit goes to the patient also, the boy who followed it religiously. So uh, he 50% work was done by that, because he followed it. And then he skipped all the wheat products and also the milk and milk products. And I told him to follow a diet of moong. So when this he told me, he was actually very depressed. He said that I'm always lying on the bed, my friends are playing outside, and even I cannot walk for 5 minutes. So for a 14 years boy not able to walk for 5 minutes, that is really depressing. And he was very depressed. And then I counseled him. So another thing, we have to also counsel the people, client. And then I counseled him, and I told him that you will be okay, you will be fine. And I gave him the murmur, like forget and forgive murmur, and murmur for the to get better sleep and everything. So that I suggested. So I changed his diet, his lifestyle. I told him you eat moong, and I gave him recipes. So we cannot only say ki eat moong, we have to tell recipes also, ki how to eat moong, because it also has to be tasty, otherwise people will not take it. So I told him some recipes. Of course, that was we had a booklet from Ayush Shakti where the recipes were already there. So I handed it to the patient, and then I told him, please follow this diet and you will feel better. So he got convinced. So that was the first thing, that he got convinced that yes, this can help me. And then after 7 days, when he came along with his father, his chest pain had gone. And the person who was not able to walk even for 5 minutes, he played for 2 hours. And actually I was also surprised, and I said, what, you played for 2 hours? He said yes. And I asked, so what were about the chest pain? He said, I had little bit of chest pain. So I said, what little bit? So he said, for 2 minutes I had the chest pain. Then I said, what did you do? So he said, no, again I continued, because you told me na, that I'll be okay. Then he said, yes, I played for 2 hours. Then he got the confidence. So he got the confidence with that. And then another 7 days, after next 7 days, I again called him. So now when he came after 15 days, he told me that he was cycling. So even one step ahead, he told that he was able to even do cycling, and he was playing with his friends, and he was so happy. And actually he was very thin, very very thin, and according to his BMI and everything, he was very thin, excessive thin. So I told him, now Samal, we have to also increase your weight. So he said, but no, I am to following diet, so how will I increase the weight? So I said, no, we will see that your weight will be increased, you become happy. because when a person is happy, that is also one thing to increase weight. So he was depressed now, so his weight was not increasing. So I said, now you just forget everything. Now you are able to play. Don't be depressed. Be happy. And the next after 7 days, I again called him. So his weight increased by 1 kg. And we have the testimonial of that patient also. His weight increased by 1 kg. And I also became so happy. And then his chest pain was not there. I asked him whether you had chest pain. He said no, the chest pain was not there at all. And then of course he was happy and I was also more happy. So thanks to the Ayush Shakti medicines, they work wonderfully. And then he till now he is coming like for follow-up and everything. He does not have chest pain, and he has increased overall 2.5 kg weight also, following the
Okay,
move diet. So I
great.
told Samal, now you can yes sir.
Yes,
Should I
it's
continue?
from this example, we got the many messages. Giving a confidence, hope, belief, consideration, convincing can make a big difference. It's not only giving advice, but giving advice and to give support, provide the material. And the top most important, like that like father brought him his son to many other allopathic doctor, and because all the reports were normal, nothing showing, they were not doing anything. That, but this small boy was suffering. That was the fact, that he couldn't play. Maybe he was like saying that like I had a pain, but not able to play. That was the fact. And Ayurveda has a possibility to see beyond the reports. It's not only the report. Can anyone guess that since how long Dr. Komal is associated with Ayush Shakti? Can anyone guess? She is less than 6 months. But she has learned all Ayush Shakti philosophy principle at such a deep level. And this is what we want. Same for all of us in this group. We don't want to wait for 3 years of education. We want to start doing from the first month itself. And that is our the target and goal, that we are the different, unique. Anyone joins Ayush Shakti, any Ayurvedic doctor, we say that in this world, on this planet, so many Ayurvedic doctors are there. But being an Ayush Shakti Ayurvedic doctor, you are a different and unique. And for that, every one of us does something different, which otherwise no doctor does. Think beyond. So we all are committed to do something special for this society. We will contribute differently. We have one more doctor. Before we complete today's session, we will hear another doctor who has just in the short span of the practice produces super great result, which otherwise any of us, including me, to establish and to reach that level took years of time. But see, achieved that level of like practice and results just in the few months. Dr. Rajsi, we hear something from her, please.
Thank you so much, sir. Thank you. Hello, everyone. I'll share one case study of mine. The patient named Prakash he was a hypertensive and a diabetic person. He was having his medicine since 1 year. And there was no result. Like his sugar level was always like 300, 400. and his BP was 140 by 100. So he came to Ayush Shakti, and with obviously with proper diet, some home remedies, and he followed proper diet, like religiously he followed. And I have given him his HbA1c was 10.6 in October, and then I have started with Sugarid, Dibahar, Brainto, Bliss, because I felt through the pulse it was stress related. His sugar level was, increased. So I added Brainto also, Bliss and MetaBoost, and Sugarid and Dibahar. So now his HbA1c is 6.1. And then his BP was always 140 by 100, but now it is 130 by 70. And he's still following the diet very religiously. So I felt really happy after this, because our medicines are like amazing. Amazing.
Great. This is what, when any of our client gets the result, we being a doctor, practitioner, supporter, practitioner, we also feel happiness, satisfaction of doing work. It makes us joyfulness. Yes. We could see the happiness on, we can see the happiness on her face, Dr. Rajsi, and we could also see the happiness on Dr. Komal's face when she was talking about the other boy. It's the satisfaction beyond anything. This is what comes from the heart. We give the treatment not from the knowledge only by brain, but from heart. And then definitely Dr. Ram was saying always that it works. We have many such stories, but unfortunately now I need to leave. You all will continue this session, because I had taken the break from the consulting clinics is on, and now the already clients are there. So I need to go. We need to go. Dr. Komal has a client. She will share something. Dr. Ketki madam, Dr. Rajsi madam, all just continue. All the best. We have one more doctor. Oh, good. Dr. Kavisa. Maybe you can also share something. See, the point and message is every one of us has a possibility, capacity, strength to do transformation. Only we need to put our efforts little differently. And we are committed for that. So it's not only Dr. Hemang, but you have whole Ayush Shakti. Everyone is special. Dr. Komal, please, Dr. Kavisa, Dr. Ketki madam, just continue the further session. Thank you. And sorry, I need to leave. Bye-bye. Thank you. Take care and please.
Bye-bye.
And whenever you all are done, just you all can just leave the meeting and then finish by its own.
Hemang.
Okay. Yes, madam.
Hemang in advance. Many
Thank
happy
you.
returns of the day.
Oh,
Happy
yes. Happy birthday. Yes.
Because
Thank you.
Here in India, still it is 1 and 1 hour.
1 hour left. 1 hour left.
Whenever.
That's why we can wish.
Yeah. Afterwards. Thank you. Thank you.
Yeah.